Hello. So my client is a 51-year-old female. Their initials are BP. They have 3 living female children. Their parents, one of the mother is deceased and the father is still living of the clients. The client has 2 siblings, a female and a male. The parents of the client's parents, so the client's grandparents, are both deceased on both sides. The client has 4 aunts and 1 uncle on the paternal side, and the uncle is deceased. And then the client has 2 uncles on the maternal side, and both of them are still living. So the client presents with reflux, hypertension, anxiety, depression, multiple sclerosis, fibromyalgia, PTSD, and migraines. So what I found interesting from this is that there was a direct tie of cancer, diabetes, and also heart disease. So when looking back through, there is a risk of colon cancer specifically because the client's father, the client's brother, and the maternal grandmother either had colon cancer, which her father did, or they had colon polyps. So what I found interesting was colon polyps there's a bunch of different types of them, and only 5% of those are cancerous. However, after 10 years of having a polyp, they have an 8% chance of being cancerous, and after 20 years of having that polyp, it is a 24% chance of cancer. So due to this, the client is having to have colonoscopies more frequently than others due to the fact that her father did have colon cancer. Another risk was heart disease. So heart disease, initially the client is at increased risk for it due to the fact that they have hypertension. However, other family members that have the heart disease is the paternal grandmother, their sister, maternal uncle, and paternal aunt. So what I found interesting about this was the fact that diabetes actually increases your risk for heart disease due to the fact that high blood sugars can cause damage to the arteries within the heart and other arteries within the body. And the final risk for the client was the risk of diabetes. So the client had several family members diagnosed with diabetes, and actually how they evaluated diabetes wasn't so much with family members who had it, but there were also a lot of other factors in play. So weight was one of them, which the client weighs 209, so they are at an increased risk due to being overweight. Lack of physical exercise, they don't really exercise other than their full-time job, so that also increases their risk. They have a current diagnosis of hypertension, which increases their risk. And then also age plays a role in it. So the older you are, the more risk you have of developing diabetes. So overall, I would say that the client was very aware of all of these concerns, and they do manage their conditions very well. So they are taking their medication for high blood pressure. They are doing the screenings for colonoscopies to check for polyps and cancer, and they also are currently on Ozempic for their weight to try to lose weight, to also avoid, because they are pre-diabetic, so they are trying to avoid becoming diabetic and having to take other medication to treat that. So overall, I found that while there were other conditions that were common, such as anxiety and depression, these were the 3 most pronounced ones within this family genogram. Thank you.